LULAC, the League of United Latin American Citizens. We are the largest and oldest Latino civil rights organization in the United States. Our mission is to advance the economic condition, educational attainment, political influence, housing, health, and civil rights of the Latino community of the United States. I have the pleasure of moderating this evening's Cafecito. So if you have any questions throughout this event, make sure you drop it in the Facebook chat or in the Zoom chat, and we'll try to get to it. Today, we have some great guests joining us to talk about some very important topics, including diabetes within the Latino community and the need for better understanding of Latino health. We will also be introducing the All of Us research program and its efforts in finding personalized healthcare treatments, as well as learn about how to attain reliable health resources. But before we get started, I would like to ask everyone to pull out their cell phones and scan the QR code as shown on the screen, and Liz will be dropping the link in the chat, and then Viviana will be dropping the link in the Facebook chat. We would really appreciate it if you guys could fill out this survey. It's a quick 3-question survey just to help us for future conversations. So I'll give you guys a few minutes to do so, and then we'll get started. Hello, so welcome. Today we'll be discussing diabetes in the Latino community. Diabetes is a condition that affects millions of people in the United States, yet members of some racial and ethnic minority groups are more likely to have diagnosed diabetes than non-Hispanic whites. It is important to get some insight into understanding why those rates are so high in the Latino community, and that's why today we're joined by some great guests who will be engaging in this important conversation. I would first like to introduce Dr. Sandra Sobel. Dr. Sobel is a board-certified clinical endocrinologist with additional board certifications in lifestyle medicine and obesity medicine. She is founder and CEO of Summon Health in Pittsburgh, Pennsylvania, a direct care metabolic health clinic that focuses on comprehensive diabetes and obesity management. She has published on diabetes and diabetes technology in medical textbooks and peer-reviewed journals, and has spoken on these particular topics at national conferences. A proud Latina herself, she is passionate about educating others about the risk of diabetes in the Latinx population. Welcome, Dr. Sobel. I'd also like to introduce Dr. Jeannie Concha. Dr. Concha is an assistant professor in the Department of Public Health Sciences at the University of Texas at El Paso. She is a public health behavioral scientist, and her research examines the intersection between social cultural factors and diabetes risk and management in marginalized and ethnic and racial groups, particularly among the Hispanic populations. Thank you so much for joining us today. I would like to start off today's conversation by asking Dr. Sobel if she could give us an overview of what is diabetes, and if you could share your experience in the field of endocrinology.
Absolutely. Thank you, Jennifer, so much for moderating. It's a pleasure to be here this evening and answer questions along with Dr. Concha here. And this is so timely too, because as some of you may be aware, and if not, the month of November is the month of the National Diabetes Awareness Month. And unfortunately, diabetes, specifically type 2 diabetes, impacts the Latino community more than non-Latino white individuals. And so it's important to understand what is diabetes. And so diabetes essentially is when the pancreas cannot produce enough insulin and enough good quality insulin to keep blood sugars in good range. So insulin is a hormone, and the body can sense when blood sugars are high. Why do blood sugars get high? There's a variety of reasons. The main reason is our nutrition, right? What we decide to eat. And what we decide to eat can, once it gets absorbed, can raise blood sugars. And so in response, the pancreas will make insulin to help take that sugar from the blood into different organs, into tissues all over the body, because that sugar is a source of energy. However, if there is continued insults to the body, meaning a lot of excess sugar that the body just doesn't need at that point in time, it can store it up to a certain point where it just can't do anything with it anymore. And the pancreas is working overtime, trying to keep the blood sugars under control. But eventually the pancreas says, you know what, I can't do it anymore. I can't do it anymore. I can't make enough insulin. I can't make enough good quality insulin. And so the tissues also don't respond to the insulin that the pancreas is making. And that's when we start to see blood sugars go up. And that's type 2 diabetes. I'll just briefly mention that there's another process. It's an autoimmune process where the body mistakenly says, oh, these cells in the pancreas that make insulin don't belong to us. And they attack those cells. So then the pancreas just can't make any insulin. That's a different type of process called type 1 diabetes. And so the individual just can't make insulin. And those are the two different types. The overwhelming majority, more than 34 million individuals here in the United States have type 2 diabetes. And so that's the one that most people think of when we discuss type 2 diabetes. And as an endocrinologist, we specialize in diabetes, and an endocrinologist is a specialist in hormones. And as you heard me say earlier, insulin is a hormone secreted from the pancreas. And the purpose of the endocrine system is to make sure that there's a balance in the hormones that are secreted. And there's a variety of organs in our body that secrete hormones, and it's this regulated process. So in diabetes, the pancreas just cannot keep up. It's this insulin resistance that builds over time. And unfortunately, blood sugars start to rise, and that's when symptoms start to present.
Thank you for sharing the differences between type 1 and type 2. And you mentioned that type 2 is the most common in the Latino community. How can someone lower their chances of developing type 2 diabetes?
So excellent. What we understand with the development of type 2 diabetes is usually there's this increased or continuous exposure to excess glucose, excess fat tissue. This inflammation ensues, and then that's when the pancreas is trying to compensate and keep up. And so one of these sources of excess comes from nutrition. We know that poor quality nutrition increases an individual's risk of diabetes. For example, sugar-sweetened beverages. Those include sodas, juices, as well as lemonades, iced teas, and even these sports drinks where they have a lot of sugar added. Also, ultra-processed foods, those also increase risk. These are foods that have had a lot of the natural nutrients stripped away from them, like chips, like pretzels, crackers, even white rice in excess, white breads. Again, these are all really ultra processed foods that can increase the risk. Also, other risk factors include weight. So if someone has pre-obesity or obesity, other risk factors include a large or an increased waist circumference. And all of these things can also be something that can be addressed by lifestyle. So understanding the importance of good quality nutrition, physical activity, being sedentary is another risk factor. So increasing engagement in exercise or movement, moving around, that's really important too. There are certain medicines that can increase the risk of diabetes also. So being aware of those medicines, such as steroids. Sometimes, an individual needs to take steroids because of significant pain or a respiratory infection, or even respiratory problems like asthma, but repeatedly having to take these medicines time and time again, increases the risk of insulin resistance and the development of diabetes. And so one of the main thing we discuss when someone is newly diagnosed with diabetes is number one, looking at lifestyle and addressing the lifestyle factors that may have contributed to the diagnosis of type 2 diabetes.
That's a good point that you said, understanding the goal. I mean, understanding of good quality nutrition is like the first important step. My grandma and my dad both have type 2 diabetes. And sometimes there's like a misunderstanding of what's actually good for them to eat and what's not. They're like, this has low sugar, but when you, in actuality, when you look at it, it's like very high in sugar, but they're under the assumption that it's like okay for them to have. Okay, so I want to turn the next question to Dr. Concha. In your work with investigating type 2 diabetes and diabetes risk in marginalized ethnic and racial groups, what have you found to be some factors associated with the higher prevalence of type 2 diabetes in the Latino community?
Hi, thank you. You know, one of the reasons I'm drawn to diabetes, and I don't know if I just like complexity in my life, is it's so complex. There's so many factors that contribute to the risk and development of diabetes, particularly in ethnic and racial minority groups. So I'd like to highlight that it's not only the Hispanic population that experiences high percentages of diabetes, it's also the African American population, the Native American Indian population, the Asian population. So it seems to be every ethnic group in the country. And you know, within the Latino Hispanic population, we experience diversity there as well. And there's a lot of research that shows, you know, newer immigrants to the US have lower percentages of diabetes compared to those who have been here for a really long time. And like Dr. Sobel was saying, there's something about lifestyle that really contributes to the risk of diabetes. And, you know, there's the direct causes that Dr. Sobel was mentioning, and there's the indirect, right? And so and I love that she said balance, because it's very true. It's about balancing everything in your life. The foods that you eat, having good balance, physical activity. Oftentimes in the United States, the Latino Hispanic community may live in environments that are not supportive of health. So I've worked in New Mexico before in rural communities, and you know, we emphasize healthy eating, yet the only store they have is Family Dollar. So talk about the access to processed foods versus healthy, nutritious foods is important. So, you know, what do you have around you? What is supporting you? Oftentimes, unfortunately, you know, and again, the Latino population is very diverse when it comes to socioeconomic status, education, but in the US, there are a lot of Latino populations that live in lower resource communities. And that involves not having access to places where you may maybe engage in more physical activity, not having affordable, nutritious foods. And so oftentimes we default to like the fast food, what's quick. And oftentimes a lot of Latinos work 3-4 jobs, you know, and time is always an issue. Oftentimes many Latinos work night shifts. And I know there's newer research showing that people who work in the evenings are actually at higher risk of developing diabetes. So there's many factors that contribute to developing diabetes. And the thing about diabetes is you have to think about how active you are, balancing your nutritional intake. So it's not all processed carb foods, you know, drinking more water helps a lot. Stress, there's a lot of research to show that there's been longitudinal studies. These are studies that have been done over years where they follow people. And they found that individuals with lower SES and lower education who are depressed actually predicted the onset of diabetes. So looking at your emotional, mental health, well-being, all those components really contribute to the risk factors. So yes, it's behavioral, but we also want to think about the social environments that we live in and how we navigate them. You know, it's so easy to just buy into going to the restaurant and eating the full meal that they serve you, and the fast foods and the processed foods. They're cheaper, easier. And so oftentimes, we think about newer immigrants, they probably come in and are still eating, more home cooked meals. And then when we start working and we integrate to this more US quick convenience lifestyle, it's easier to get fast food, it's easier to go out and eat and just, eat what they serve you. And so I don't think we're conscientious of how balanced our life should be and just kind of consume. And so there's a lot of factors that you have to take into consideration, and managing and both the risk and when you have diabetes, you have to think about everything, your medications, being active, eating nutritious, balanced meals with the correct portion size. Our portion sizes are not what they should be. Making sure we pay attention to how we manage our stress, and like I said, taking your medications and making sure that we talk to our doctors. A lot of Latinos are underinsured or not insured, so they don't have access to their doctors. So oftentimes we wait till it hurts because, it costs. And unfortunately, diabetes, you don't feel the symptoms till it's really too late. And that's when people start losing their vision and they start noticing some numbness in their fingers and limbs. And so there's a lot of factors to consider. Unfortunately, there's also a lot of misinformation about diabetes. And I'm very happy that Dr. Sobel mentioned that, insulin in the pancreas are sort of the direct cause of diabetes. There's a lot of different beliefs. And so it's important to get the right information. And that can be difficult because in the information age, we can find our own information. But there are credible diabetes education programs. So it's a matter of accessing those. So I know I gave you a broad answer, but there's a lot of answers to that question.
Yeah, no, thank you for sharing that. Can you talk to us about diabetes management and some treatment options available? Like I know insulin is super expensive. So can you speak a little bit on that?
I'll sort of speak on some management, and then I'll let Dr. Sobel speak about the insulin. So I think one of the important things is knowing your status, where you are, some basics. So for individuals who don't have diabetes, I think it's important to know what your status is. Are you pre-diabetes? Do you have, knowing your A1C? A lot of people don't know what an A1C, even people with diabetes, I'll ask them and they don't know what their A1C is or what it is. And so that's very important. Knowing your numbers, knowing where you're at is extremely important to start. And then being able to monitor your sugar levels by checking yourself. I know it's difficult for a lot of people, but you don't have to do it every day. You can do it, some mornings, some evenings. So I think that's very important, is knowing where you're at and how your body is working. And then, so there are treatments, medications, definitely. But like I said, it involves many behaviors, not just taking medication. And education, I don't think people really realize that that's a treatment. So there are national programs. There's the Diabetes Self-Management Education and Support Programs. These are certified through Medicare, Medicaid, and they're known as sort of a gold standard education. Seeking that program will give you some basics on diabetes. And then there's a diabetes prevention program, which is for people with pre-diabetes so that they don't develop diabetes. We have a program called the Diabetes Garage where we're actually, it's prioritizing men because men have a high prevalence of diabetes in the Hispanic Latino population. And oftentimes I will tell them, do you think it takes some basic knowledge to drive a car, and know how to maintain a car? And they'll say, well, yes, of course. Would you let someone who didn't know how to drive your car, would you let them drive your car? And they say, not at all. So we say the same thing with diabetes. There's some basic rules to the road for managing diabetes, and it takes practice. Just like it takes practice to be a good driver, it takes practice to be a good manager of your diabetes. And so It's knowing the rules to the road and practice. So I'll hand over the insulin to Dr. Sobel.
Wait, before you go, someone said what kind of medications are available? Like,
there's many, so I'm going to let Dr. Sobel talk about
okay.
I'm happy to discuss the medications because, like Dr. Concha said, there are so many. I just want to highlight several things that she said because they're so important. They're worth repeating. Number one is knowing your status. And that even includes when you should be screened. So just this year too, the age to start screening changed. So if you're 35 years old or older and BMI, that's body mass index, and you can go online and Google body mass index and put in your weights, you put in your height. And if your body mass index is greater than 25, you should be screened for diabetes. Okay. And then if you have a strong family history of diabetes, you need to discuss that with your physician as well. You know, we've been discussing how Latinos have a higher risk of diabetes. And so that's a conversation that's really important for Latinos to have with their primary care physicians or whomever their physician is. Prediabetes is something to take seriously. And unfortunately, in the medical community, due to time constraints or whatever it is, I think we fall short in emphasizing how important it is to take that seriously. Because if we just mention it casually, then obviously the patients will think, oh, but it's not diabetes, no big deal, and really don't understand that you can make the biggest impact then and reverse course. And so there have been studies, the diabetes prevention study, that showed that lifestyle changes far outperformed medicine in preventing progression of diabetes. So lifestyle has a profound impact. And I come back to that too. I'm going to mention the medicines, but one thing I'll also say is with the medicines, as wonderful as they are, and they're important to take when you need to take them, they're expensive too. And when you have to take multiple ones, you have to start thinking about the interactions they have with other medicines. And so if you can really do something about behaviors and understanding the disease and making the appropriate changes, you can prevent the need to take these medications and the costs and side effects that potentially could go along with the medicines. Let me discuss medications. There are a variety of medicines. The one that we traditionally use first is called metformin. And metformin is a medication that's been around 4 years. And I'll just briefly mention what they do. And then, I'm happy to get into more details if individuals would like, but that's a pill that's taken every day, once or twice a day. And the way it works is it prevents the liver from making sugar. And it also makes the other tissues more sensitive to the insulin that the pancreas is making. You heard me say part of the progression to diabetes is the body starts getting insulin resistant and then diabetes happens. And so metformin helps improve insulin sensitivity also. But there can be side effects, and sometimes people say an upset stomach and so forth, but it's an excellent medicine. And one of the nice things also about metformin, not only is it excellent in how it helps with blood sugars, its cost is also low, so it's affordable. Some of the older drug classes that we've used, so one is called the sulfonylurea, and then the glitinides. Those are medicines, those are pills also. What they do is they increase insulin production from the pancreas. They're also lower in cost. One of the side effects that is unwanted is weight gain. You heard me say, weight is a risk factor for diabetes. And so, it's not really desirable to take a medicine that potentially could increase weight. And also, it will make the pancreas produce insulin, whether you're eating or not. So if you have a really busy day and you're running out the house, you take your medicine and, you don't get to your breakfast until much later, or maybe you don't have breakfast and you get to lunch, you have a risk of having a low blood sugar, which can be very serious. And so those are important things to keep in mind. But again, cost, especially for the sulfonylureas, is something that makes it a more accessible medication. And then one of the ones that we hear about and see on commercials nowadays. So one of them are the SGLT2 receptor inhibitors. Those are pills. Those are also taken once a day. And the way they work is that they prevent the kidney from absorbing sugar back in the system, right? Our kidneys filter the blood, we make urine, and we pee out excess of whatever we don't need. And when that happens, we will reabsorb sugar. But these medicines purposely block the kidney from doing that. And so you pee out sugar instead. And so some people notice that they might pee a little bit more. And it's important to stay well hydrated with water. And they also have other benefits. They don't cause weight gain. Some people have a little bit of weight loss, but they also have been shown to be helpful for the cardiovascular, the heart system, the blood vessels, as well as the kidneys. Cost is an issue. They are expensive. Another drug class, so these are the GLP-1 receptor agonists. And so they are injections. And whenever someone hears injection, automatically they think insulin, but this is not insulin. It's a hormone. And it's an excellent medicine that we have in our arsenal, in our bag to treat diabetes. The way that this medicine works is it slows down the transit of food through the body. So people notice that their appetite is curbed or they're not as hungry. If you eat, then it stimulates your pancreas to make insulin, which is, if you don't eat, it won't do that. So it minimizes the risk of a low blood sugar, which is great. And also a nice side effect is weight loss. And it has also been shown to be protective or good for cardiovascular health, as well as the kidneys. Again, expense is an issue, unfortunately. I will just make a brief mention that there is one medicine out in this drug class because it's traditionally been injections. There's one pill that's now available, but again, cost is an issue. Those are the major drug classes that we pull from for management of diabetes. And then we have our insulins. And so a couple of things, and there's a lot of misinformation like Dr. Concha was saying as far as insulin therapy. And it's important, again, that the diabetes care team, that we do what we need to do in educating what that insulin means, the different types of insulin, their purposes. Sometimes people think if they have type 2 diabetes and they're put on insulin, that automatically they have type 1 diabetes, and that's not true. Or if insulin is needed early in the disease process, people get concerned that they'll always need to be on insulin. And that's not necessarily true either, because again, big changes in lifestyle can reduce the need for insulin. And some people might be able to come off of it and still need other diabetes medicines. But there are two types of insulins. One's a long-acting insulin that's usually taken once a day or twice a day. And the purpose of that insulin is to control the amount of sugar that the liver is making, okay? Everybody's liver makes sugar. People who have diabetes, their liver makes more sugar than it needs to. And so we need to keep that in check, keep that down. And so that's what these long-acting insulins do. And then obviously when we eat, that's a source of rapid rises in blood sugar. And so we need an insulin that will also rapidly act to keep those blood sugars under control. So those are known as rapid acting insulins, and those are taken before eating. And so those two different types of insulin therapies can be used to help keep blood sugars under control. And there are a variety of different insulins in each of those classes, and we would need to have a 4-hour conversation for me to go over all of them. But again, I'm happy to answer any questions about those. But we have a large arsenal of medicines, thank goodness, right? Science is important, taking medicines is important. And so taking the medicines in conjunction, in addition to what you eat, physical activity, stress management, sleep, everything also that Dr. Concha was saying, all of that is really important in achieving the goal of blood sugars.
I just want to add something that's very important that we notice with some patients is they'll just take the medications and really not know, where it acts. So it's really important to know what part of the body the medication acts on. It can act on the liver, the muscles, the brain, the kidney. And, we always use the comparison of it's a tool. And just like you have your cables for your car, you know they work on your battery, they don't work on your tire. And you know when to use it. And so it's important for people with diabetes to know where their medication is acting so that they know and understand how it's functioning and then when to take it. A lot of times we see people aren't taking it at the right time. So it's sort of use these as tools, but use the tools correctly is really important. I just kind of wanted to add that because a lot of people really just kind of take the meds and don't really think about what it's doing to your body. So just want to add that.
Thank you so much to both Dr. Sobel and Dr. Concha. This was very informative. Thank you, Dr. Sobel, for going in depth about what's the difference between type 1 and type 2 diabetes and kind of like preventative measures people can take from developing type 2 diabetes, and kind of going into detail about the medications available to those who do end up developing diabetes. And thank you to Dr. Concha for sharing, a few factors that contribute to the higher rates of type 2 diabetes in the Latino community, and for sharing ways to manage and to treat that. These health disparities, which were highlighted by both Dr. Sobel and Dr. Concha, show the need for a better understanding of Latino health and finding personalized health care treatments. And that's really what the All of Us research program is working towards. Since 2018, LULAC has supported the All of Us research program in its goal to help researchers understand why people get sick or stay healthy. We want to support researchers in efforts to understand how different genetic, lifestyle, and environmental factors impact health and disease. This is called precision medicine. And with this information, researchers can look to improve ways to diagnose, prevent, and treat health conditions such as diabetes. Our next speakers are here to share with us their collaboration with the All of Us research program and how it's working to improve the health of generations to come. I'd first like to introduce Dr. Viviana Mancera. Dr. Mancera is an associate professor of research in the College of Science at the University of Texas at El Paso and the director of community engagement of the Border Biomedical Research Center. She focuses on assessing barriers and facilitators to healthy outcomes and engaging the community to increase the participation of Latinos in biomedical research. Welcome, Dr. Mancera.
Thank you very much. Thank you for this opportunity. I'd like to say, first of all, I am a LULAC member, proud member of Council 4875 here in El Paso, Texas. I am also a Latina. And as a researcher, investigator, I want to also mention I am a volunteer for the All of Us program. In other words, I have participated. I have given my samples of saliva, of blood, of urine, and also participated in surveys assessing my behavior during COVID even, which I thought was really, really interesting. And I'm also an investigator on the other side through the workbench where the data is being stored. So for me, this is very personal on many levels. As a Latina and as a Hispanic or as a female, we know that around 2% of the entire Latino population participates in any sort of biomedical research. This is really critical to us because as scientists develop new therapeutics, medications, or treatments, we don't have enough of a database to understand how this is going to affect us, our bodies, how we differ from other populations. And so if we can't advance this, physicians like Dr. Sobel cannot prescribe newer medications that don't have as many adverse side effects on our population. We know that many therapies are tested against non-Hispanic whites and a lot of males. And there is a difference as well, because with females, of course, we have different ratios and different types of hormones, which also come into play. And so the All of Us program is really key in advancing the science. This is a huge initiative that NIH has invested millions of dollars. And so the goal is to establish a cohort or a large group of people of 1 million or more who are of diverse ethnicities and health statuses. So to participate, you don't have to be a healthy individual. As a matter of fact, I'm also on a virtual advisory team through Scripps Research, the Translational Center at Scripps Research. And on our panel, I'm very proud to say that we have, I think I'm probably the healthiest individual on the panel. And most of them have severe and maybe one-of-a-kind illnesses that have no cure. And so they're so passionate about the program, about donating their tissue, any of their biospecimens, because they know that in the future, they'll be able to make a difference. And that's really what we want to do, is make a difference now and in the future. I may not see results of anything that happens in my lifetime, but it may occur for my children and my grandchildren. And so, when we think about diabetes, of course, it's twofold. There is a genetic component as well as the environmental component. So if we're looking at genetics, if we don't have any of these samples that scientists can look at, we might not ever be able to unlock any of these key bits of information that can help, again, with treatments and drug therapies. So it is so important to participate in something like All of Us, because this is a way to advance science. It is precision. I mean, people don't understand necessarily the concept of precision medicine, and it just means that it's personalized. Hopefully we'll get to the point that medicine will not be a one size fits all, and no offense to any clinician or healthcare provider, but they are working with the tools that they have. So if we can get it to the point that we can look at somebody's genetic composition and say, you know what, this would probably be a good treatment for you. Your body would probably respond better to this treatment as opposed to that treatment. So, as a Latina, I also have family members who are diabetic, have other chronic diseases, cancer, all sorts of diseases. And so I would like to think that we can contribute something now and see if we can advance the science and improve our health outcomes. At the University of Texas at El Paso, we've been partnering with the National Alliance for Hispanic Health for over 3 years. And we do have ambassadors who make presentations to our students and to the community. And so their objective is to get people to participate. And it's wonderful because right now, El Paso is 82 to 83% Hispanic or Latino. And so that's key for us in many aspects, because we know that we can use a lot of information that we gather here in El Paso and generalize it or take it to other populations of Latinos across the United States. And as Dr. Concha is developing frameworks on how to manage diabetes behaviorally, Dr. Sobel can work on Latino communities on how to treat them with, as a physician. So I think the program is just wonderful. There's so much information that we can gain from participating in the program. And I would encourage all my fellow LULACers out there to participate. This may not make a difference for you, but again, it could. And if anything, think about the future for your kids, your grandkids, your great-grandchildren. Thank you all.
Thank you. You brought up a good point. We're 18% of the population, but only 2% are in medical research. So it's like hard to really understand the why, the answers of how certain, conditions or diseases affect us. And you brought up an important point to say it's important to be included in that medical research because it advances science for generations to come. And that's basically what it's all about and why the All of Us research program is so important. And so that brings me to our next speaker, who is Mel Lopez. Mel has been a tour manager for the All of Us research program for several years, traveling across the country to bring awareness and education about the program to all communities. As a Mexican-American woman, she became involved with the program in hopes of seeing more people like herself in medical research. Welcome, Mel.
Thank you so much for having me. So as Jennifer mentioned, my name is Mel Lopez and I'm with the All of Us research program. And then I have a slide for you. So before we get started, who wants their medical providers to give solutions that are specific to you as an individual? You can type it in the chat or you can raise your hand. I like to raise my hand. Yep, I see that a lot of people actually agree with me, and so do I. I definitely agree that I would like personalized medicine. Next slide. Now, today we heard a little bit about health research, and I want to provide some background on health research. Health research is the process of finding out new things about improving people's healthcare. It is important because we want to live long and healthy lives, right? This is the foundation of the All of Us research program. Health research can only help people of all backgrounds if people of all backgrounds get involved. All of Us is a large program led by the National Institutes of Health that's working to promote healthcare through research. Unlike research studies that focus on one disease or one group of people, All of Us is building a diverse data set that can inform thousands of studies on a variety of health conditions. It is a longitudinal effort, meaning it will last 10 years or more, to gather data from at least 1 million or more people living in the United States that reflects the diversity of the United States in order to accelerate research and medical breakthroughs to enable an individualized prevention, treatment, care for all of us. Next slide, please. We did talk about precision medicine, and we each know that all of us are different. Our habits, our environments, our genetics, and that interaction of these factors greatly impacts our health. And like it was said earlier, when we visit the doctor, not all treatments, most of the time it's one size fits all. To provide healthcare that meets everybody's needs, we need precision medicine. Precision medicine focuses on treating a person's specific healthcare needs. In order to understand everybody's specific healthcare needs, we need more health data from as many people as possible. And that is where precision medicine research is a radical shift in how each of us can receive the best care possible based on our unique makeup. Next slide, please. The program welcomes participants from different races, ethnicities, age groups, and regions of the country. We want to make sure everybody is included. Participants are also diverse in gender identity, sexual orientation, and health status. You can be healthy or you can have an existing health problem and you're still welcome to participate. Diversity in a research program is important for several reasons, including where you live, how you live, and our backgrounds can affect our health. Also, many groups of people have been left out of health research in the past. By studying a diverse group of people, researchers can learn more about what makes people sick or keeps them healthy. That's what researchers could learn about better treatments and disease prevention for all of us. Next slide, please. Very important topic, security and data and privacy. Safeguarding your identity to the best of anyone's abilities is our most important responsibility. We take privacy and security very seriously, and it is a top priority in the program. We use the latest technology to help keep your data private and safe. Identifiable information, such as your name or your address, they're stripped away and you're stripped away from your samples and you are assigned a unique code. When research does begin, researchers sign an affidavit saying they will not try to find out who you are. Survey and all personal information are kept saved on an encrypted server with limited access. We also hire a third-party agency to continuously hack into our system to keep it safe. The program even has certificates of confidentiality from the government to help fight legal demands that could give out information that could identify you. And just like our banking systems, security can never be guaranteed 100%, but risk can be minimized as much as possible. And always remember, participation is voluntary. If you decide to participate, you will be asked to answer health surveys. Some people donate DNA samples and their electronic health records. Just remember, it's all up to you as however much information you would like to share. I chose to become a participant because I felt my information was safe and secure, and I also like that I can access it at any time. Next slide, please. Okay, I hope you have your cafecito. So now you're probably wondering what's in it for me. Well, by participating, you have a chance to learn about your own health, including personalized risk factors and exposures. You also have the ability to and choice to access your own data, including increasingly rich health records and ancestry trait information. You also have an opportunity to ensure that your community is included in medical research, and this will help address health disparities. Participants can also discover through our research hub about research that's currently being done with all of us data. There are currently 870 active projects, and 22 of those projects are related to diabetes. That's awesome, and it's only continuing to grow. The matter of fact is the Latino community has been historically left out of research, and when you're left out of research, you can be left out of the solutions. Your participation in all of us makes it possible for your community to be represented in medical research. Thank you, Liz. Liz was sharing my slides. I'm sorry, Jennifer, I believe you're muted.
I'm sorry. I was going to ask, how can someone get involved if they wanted to join?
Oh, definitely. Now, in El Paso, I think I have a slide that can share their website. In El Paso, you can visit joinallofus.org/togetherelpaso, and we'll also type that into the chat. You can also scan the QR code that you see on the screen right now that will take you directly to our website. I know that I'm from El Paso, and so I have my ninos and my nephews and everybody signed up, and they went through the website that you see on the screen. Thank you.
Thank you to Dr. Mancera and Mel for introducing us to the All of Us research program and why it is so important in helping bridge gaps and treatment in medicine. LULAC encourages all viewers watching at home today to take the first step in understanding your health by enrolling in the All of Us research program. And now I would like to introduce Stefania Costa Ramirez, an engagement specialist with the National Network of Libraries of Medicine. She is passionate about environmental health and diversity. She has been working for the last 10 years advocating for community well-being. Stefania will be sharing a presentation on reliable health resources. So thank you so much for joining us today, Stefania. You're muted.
I'm muted. And thank you so much. I'm so glad to be here. And thank you all the panelists that are sharing with us all this amazing information. We were talking a lot about information, and we were talking about like where to go when we need information. And that is the thing that I want to share with you, because I am part of the All of Us Community Engagement Center at the network of the National Library of Medicine. And I'm here to enchase how health information can help us to address better our health. Then I am part, like for those who aren't yet familiar with NNLM, we are an outreach program from the National Library of Medicine at Center at the National Institutes of Health. We work under the same agency as other centers you may have heard on the news, such as the National Cancer Institute, National Research of Health. The National Library of Medicine is the world's largest biomedical library and maintains a vast print collection and several online resources like Medline Plus. If you ever need help finding health information, physically or in person, you can always reach out to us, your local community NGOs, or even your local library. We are here to help you. Next slide. But then why verify health information or online health information? We were talking a lot about the importance of finding the right resources. Sometimes we find all kinds of information on the internet. Next slide. But all this information makes it so important to learn how to find good health information. Like, we can't make our best choices for our own health. We can work with our health provider to make good health decisions, and we can help our communities better understand important health topics. Next slide. Then we need some tips to search information online. And although there is a lot of information in internet, we can do some things to find accurate, reliable information. Then first of all, we need to start with information from reliable sources. This can include government agencies such as NIH and the CDC, research organizations, universities, research centers, or specialized agencies that work with diabetes. So, next slide. When we try to find information about a specific topic, we need to be as specific as we can, because how we saw in a previous slide, we can find millions of results on internet, and some of them are trying to sell us things that we don't need, or they are giving us like information that it's not verified for a researcher or is not valid from the doctor's perspective. Then use as specific terms as we can. Next slide. Then we arrive to a very important point. If you found a news source, be sure to evaluate it for reliability. Like, is this good or not? This could include seeing if the source advertised anything, when they last updated, what is their sharing opinions or not, who are they are trying to targeting, try to see if they are trustable or not. Next slide. Next slide. Then we are going to talk about one of our favorite resources, and it's Medline Plus, because then sometimes Google can be an overwhelming place to start when we are trying to find that information, especially when we consider the factors that our panelists were talking about, that we wait a lot to go to the doctor. Any search on internet, any go visit to the library, it's going to replace that, but it's at least a good start. Then I recommend a Medline Plus that NNLM creates and maintains. This resource is completely free, has online health information, and has thousands of health topics, including information on drugs and medical tests. Then if we want to know more about medicine that our doctor is talking about, or someone is talking about that medicine and we want to talk with our doctor about it, you can go to Medline Plus and you can find good information about that topic. The information that you are going to find in Medline Plus, you can find in Spanish and in English. Then as Latino communities and Hispanic communities, sometimes we can find good information in English, but we have family or we have friends that they need information in Spanish or they feel comfortable in Spanish. Medline, it's available in Spanish. Next slide. Can you click again if the pictures they are not appearing? Okay, but in Medline Plus, you can find the information in English and Spanish, and you can switch between the language in the top corner of the website once you go. Then you can switch and the colors are going to change. And some information is going to be only in English, but other it's going to be in Spanish, and it's going to send you to other good resources that are already curated. And always visit your public library. Your public library is an amazing resource, and the people there, it's there to helping you to find good information. And remember, like nothing replaces your consult your healthcare provider when you're using health information online. This is a very good resource to have a conversation with your doctor and advocate for yourself. Next slide. Then I'm really thank you for being here, and always you can reach to us for more information about information online, information on site about your health or your community activities. If you work with an organization and you want to share health information, reach to us, and we are going to be here to help you to find the best resources. And how I was telling, this is very, very important, how all the doctors were telling us, try to find good resources. In Medline Plus, you can find recipes, you can find tricks about food. How can we improve our well-being and our lifestyle?
Thank you, Stefania, for sharing such great information and resources. Like you mentioned, there's so much information found online that it's hard to, find accurate or reliable information. So you offered some great tips of, visiting government websites and using those advanced key searches in either Spanish or English to find the information that you're looking for, which is incredibly important, to have access to that information in a language that, is accessible and, that you understand.
Yeah,
so
Jennifer,
sorry. Yes.
You were saying something very important. And once you go to Medline Plus, you don't need to worry about that the information is going to be complex. That information is designed for all the public, and it's going to be very helpful.
Perfect. That's great. So before we wrap up, I would like to ask everyone to scan the QR code here once again. It'll be dropped in the chat as well. It's for a brief survey, kind of just to let us know how we did today. It would be greatly appreciated. And then that wraps up tonight's event. I hope you all were able to learn how to attain reliable health resources and learn the importance of representation in health research. As we learned today, Latinos are at a higher risk, have higher rates of type 2 diabetes in specific, and being included in health research gives us the why, gives us the answers. And like was mentioned today too, the fact of the matter is that Latino community has historically been left out of research. And then when we're left out of research, we're left out of the solutions. So I hope that you all sign up for the All of Us research program to learn more about your health and take that step. And remember that it's to help future generations to come. So a special thank you to Dr. Sobel, Dr. Concha, Dr. Mancera, Stefania, Mel, and lastly, the All of Us research program for joining us today for this important conversation. Thank you and good evening.